Good Matt.
This is Democracy Now!, democracynow.org, The War and Peace Report. I'm Amy Goodman in Seattle. Juan Gonzalez is in New York. And finally, as lawmakers continue to debate health care proposals, we take a look at how the economic crisis can impact the health of people in this country. I'm joined here in Seattle by Dr. Stephen Bezruchka. He teaches at the University of Washington School of Public Health. He's written extensively on the impact of societal and economic inequalities on the health of a population. He argues combating inequality might be the best way to ensure improved health. Why is that, Dr. Bezruchka?
Basically, when you ask the question, do you want health or health care, Americans think that it's health care that produces health, when there really is very little evidence for that. What turns out to be really important is the nature of caring and sharing in society. And the best factor that really impacts that is the degree of inequality. Where societies are more unequal, people don't look out for one another, they look out for themselves. Where societies are more equal, and economic equality is the thing that is most important in this, people look after each other, society looks after each other, and pretty well everyone does better. There's almost nothing that is better in a society that tolerates the extreme levels of inequality in the United States. And so we end up dying younger than people in all the other rich countries, despite spending half the world's health care bill.
And Dr. Bezruchka, do you see any correlation between the growth of economic equality in the United States and the health of the people in general?
Yes, we used to be one of the healthiest countries in the world back in the 1950s, and now we are about as healthy as Cuba, and we've been strangling Cuba for the last 40 years. So as inequality has grown in this country, our health, though it's been improving, has not improved as fast as it has in all the other rich countries and quite a few poor ones as well. No expert really doubts that. That is, we die much younger. Even, major government documents point that out. Most Americans, of course, are not aware of that. They don't realize that they push up daisies well before their time. That's the key issue, to make Americans realize that we need to fight for health rather than for health care. I've worked clinically as a doctor for 35 years. I'm not against providing health care services, but we need to understand that that is not what produces health in society. So we need to first make known the fact that we die younger than we should. Then we need to measure our health indicators relative to other countries, and instead of being 30th in what I call the Health Olympics, we should rise up and be in the top 10, perhaps. I mean, we win the most gold medals in most Olympic contests. If we had an event for health, we should be close to the top in the Health Olympics, and we don't even show up for the final event.
Dr. Bezruchka, how does our health care system affect this, influence this, and what is the system you think would improve the health of the most powerful country on earth?
Well, if we talk of a health care system, first of all, we have to recognize health care is a very tiny factor in the health of whole populations, and that's a real polemic. What's really important is how we structure early life. Since half of our health as adults is somehow determined between conception and age 3, 4, or 5. Early life lasts a lifetime, and we are the only rich country that doesn't have mandated paid maternity-paternity leave as all the other rich countries do. So we neglect early life, and we pay the price with poor health as adults. I think in terms of a health care system, a medical care system, I think we should remove the profit motive from it. As long as we have health care insurance companies that in 2005 made $100 billion in profit, it's very hard to tamper with that kind of an industry. However, profit care is not good for our health. So I would begin by taking profit out of the system and not seeing it as a market phenomenon.
And how do you think this can happen? Politically, President Obama has not come out for single payer, but we're going to have to leave this question for the next time we speak. I want to thank you very much, Dr. Stephen Bezruchka, for joining us, a professor at the University of Washington here in Seattle, as we wrap up our broadcast. A very special happy birthday, 90th birthday, to a close friend, to Irma Justina Weiss. Happy birthday, Irma. Democracy Now! Produced by Mike Berkshire, from Doug Caduce, Aaron Mate, Angelique Kamich, Nicole Salazar, Steve Martinez, Hani Massoud, Dennis Moynihan. I'm Amy Goodman, Juan Gonzalez. Thanks for joining us.